Well, Amalia, as you know, the year 2020 was a heavy but pivotal year in our country and our service region, particularly our legacy and equity area included the highest ranked zip codes in Illinois for COVID-19. The infections, mortalities, and employment, housing insecurity, and lack of health insurance. And we as a foundation focused on listening, learning from, collaborating with our grantee partners and peer funders across our region. So we focused, advocated, lifted community voice, mobilized our response fund, and streamlined our general operating process. And yet we know at this moment it requires more. And so we turned to our community and sought to understand the immediate and emergent community health and wellness needs to inform our bold long-term pandemic response and investment strategy. Our partner insights report, Reimagining Health and Wellness report, summarizes these learnings. As we think about this, and certainly encouraged by the board to think beyond the 5% threshold to address the current and emergent needs, not just for this cycle, but for the next 3 years. What was the impetus for the board to encourage us to be bold as we continue to address COVID-19's impact in our region?
That's a good question, Maria. So this whole concept of being bold, that dialogue started with one particular board member who challenged all of us to take a bold approach. And quickly, all the other board members were in support of his vision, which is really that we exist as a foundation to help the community. And during this crisis, if we don't step up, then what is our purpose for existing? And this was at a board meeting at the very beginning of the pandemic. And at that point, we really didn't know the full scope, the impact, how devastating this would be to really the entire world. And so his view was, we need to take a bold approach. And what does that mean? That means looking beyond the 5% minimum that the IRS requires for foundations like ours to give out annually in terms of historical perspective. But we've always given out more than 5%. But we decided to give out significantly more for the next few years. I think that the pandemic was a time to, it set off an alarm for everybody and required all of us to step back and also come together to support each other. And so, we as a foundation have an important leadership role for all foundations in how you can internally structure, how you can have a plan and implement a bold approach. So I think the word bold is a great theme for us and how we're approaching our grant making for the next 3 years.
I also wanted to just highlight the fact that, our board went through a strategic planning process, but what I recall from the board, putting together some of the values that are core principles that include transparency, stewardship, trusted partners, collaboration, keywords that now are seen as bold in this response. And I think part of it is because of the time that our board took early on to really dig deep of what does it mean to achieve health equity. I have to say that I am honored, certainly feel a sense of privilege to be in partnership with a board that values community-driven data, that values transparency, that values the importance of trust-based philanthropy. And that's considered bold in itself. And to the board, that's considered just doing well by community.
It's really a team effort with the board and you and the staff. And, in my mind, we are in a unique position to make a difference. But in order to move the needle, we need to partner with others, with government, and we have with the city, with the county, and with other organizations, other foundations. So I feel really optimistic that, this is a moment of change, right? Of folks reflecting back, doing some introspection and maybe more grounding. I think as an organization, we've done that. I'm sure many others have. As individuals, So whether as an individual or a foundation or any organization, it was a wake-up call. And I think for the better, we will come out of this wiser, stronger, and certainly more well-informed about the disparities and how we can all make a difference, no matter what your area of expertise is, what your line of work is. I think everybody can pitch in some way to make a difference. We've seen how the pandemic has impacted Black and Brown communities disproportionately. There's so many statistics on that, and they're alarming. And we've also seen and know that we've always known, right, that there were significant disparities, but COVID really exposed that in stark terms for the world to see, that certain communities bore the brunt of not having the opportunities that others have, but also when the pandemic hit, the mortality rates, the lack of housing, and lack of access to healthcare were all incredible factors that created even now greater disparities. And we know that it will take a long, long time for our communities to recover, unfortunately. So we want to be there and help expedite a recovery, help address the needs. And I'm really proud of and excited about this report that the foundation has put together to frame what, from the community's input, what the impact has been and how we can mobilize and help all communities recover more quickly.
We are still learning. We are still listening to our community partners, and what we've have come to understand is how important it is to get out of the way. And I think that that's being bold. And I think what we've heard, at least from the staff's perspective, from our board, as well as from our community, it is, let's make it possible to be nimble and to respond. And if anything COVID has taught us is the importance of getting out of the way and responding quickly and swiftly. What we're hearing from our communities is the importance of what's happening within the regions, also what's happening with them organizationally, and what are some opportunities for them to think not just short term, but long term, and what can we continue. So our general operating support will allow for them to continue operating, but the nimbleness and the partnership will allow for us to think about what will it take for our communities to recover stronger. One of the concerns that I have, where will our organizations be after all this? I think that we saw that philanthropy responded quickly and swiftly to the needs of COVID. But as we know, the social determinants of health are intersected. And we need to be thinking about this for the long term. And that's why I think the Healthy Communities Foundation's board's approach, that is not about just immediate, but is certainly about looking at this over a 3-year period and beyond, to be there in partnership to make sure that we recover equitably is key and important.
Tell us about something from the report that really surprised you or you weren't expecting. I know the report is in depth and covers a lot of different topics.
Well, it became very clear on how truly connected the social determinants of health are. Specifically, we heard of the continued growth of mental health concerns. While mental health concerns were present pre-pandemic days, the mental health aspect was exasperated in our region. Now, specifically, we heard of the needs for mental health services for youth. And certainly when we think about the youth being isolated, no longer having a classroom environment with peers and being on virtual classes, it certainly is a highlight to take note of. We also heard from our grantee partners that their staff were very much affected by vicarious trauma. And we kept hearing over and over, how do we care for our caretakers? those that are serving our community. So the aspects of mental health, the broad spectrum of mental health was very clear. We also heard of the crucial role of community health workers in the Western suburbs. We know that services are present, but not many times are people connecting to the resources that are there. Now think about if that was happening pre-pandemic, how does the pandemic impact it at a broader scale? What's available? Where do they call? Where do they connect to? Are they in my community? Is it virtual services? Do I go in person? Community health workers were linked to what services are available to them, not just from a health perspective. Again, the social determinants of health became very clear. We also saw the strength, the creativity, and the innovation of organizations in our region. There's a need, let's address it, as opposed to there's a need, that's not what we do. There's a need, how do we connect? Is there something in place already? If not, how do we make it happen? Spirit really came out, and it was beautiful to see.
Maria, so from the insights that we gathered from our partners, can you describe how the foundation under your leadership took that data insights and applied them to inform our grant making?
We know that listening is important, but what we heard was very much confirming the importance of listening to those that were the hardest hit. And if we learned something from this moment in time, it is that it is important to go from the epicenter out. It is important to go into those communities, hear from them, listen to them, but also work with them on addressing the impact and the systemic impact that has been in place that became very clear. What we heard and how we are responding is basically by listening to our hardest hit communities and investing in our hardest hit communities. And it is no surprise that the biggest needs are in these communities. So we plan on making from our investments from that lens of equity deep into communities that have been long forgotten in our region, but doing so in a manner that is in partnership with our grantee partners, while also learning. We want to be a learning community, encouraging that yes, sometimes these investments will work, sometimes these investments will not work. And as you know, Amalia, as we've talked about in the past, philanthropy sometimes comes in and comes right out. And we hope to be here in partnership with our grantee partners, partnership with local government. We can't do it alone. Just like our grantee partners can't do it alone, but we will be stronger when we are partnering and collaborating for the long term. It took us quite a while to be in the place where we are in communities. And what I mean by that, it has taken a while for the systemic inequities to take hold. It's going to take a while for us to rebuild a strong infrastructure from the lens of the social determinants of health, addressing health inequities and health disparities in our region. So we plan to be here in partnership for the long haul.
Maria, what gives you hope for a more equitable recovery for our region and really for the whole country? What is it that provides you with that hope?
You know, I would say that 2020 has provided us with racial reckoning and addressing the fact that race is at the center, unfortunately, in this country and in our region. And so what gives me hope is that there has been an awakening and awareness that has been brought on of all times during a pandemic to show us that systems that have been put in place to keep communities back are rooted at the racial inequities. And so I think what gives me hope is that people have become aware and willing to address and move that full forward.
Yeah, I absolutely agree with that. That gives me hope as well. The fact that racial injustice, racial inequities is part of the mainstream dialogue now. And whether it's in the corporate boardroom or in government at every level, and that does give me a lot of hope that people are recognizing it and acknowledging that we all have a part to play in creating a better world.
Absolutely. Well, thank you for this conversation. This has been a time for us to step back and look at where we've been and where we are going. Even though we're thinking about this from what does it mean to be bold, it's a reminder that we are on this journey, continuous journey to address health equity in our region.